Welcome to EMR Happy Hour. Am I echoing too much? Anyone? Okay.
You are echoing.
Yeah, I've got to use my phone later in this presentation to show you some diagnose stuff. Let me see if I can make sure it's off.
It's not that distracting.
Okay. Sorry. I was trying all ways to fix it, but even the headphone thing doesn't work. So we're going to talk EMR, and some other kind of topics will be diagnose and Indiana Death Registry, because there's been some questions. So it's a little bit of a hodgepodge today. So these are things that we're going to cover. COVID-19 patient types, some of the updates, antibiotic indication for fluoroquinolones, a new update on patients being able to get a good faith price estimate. I thought it was interesting, so I wanted to share. Cleaning up your inbox, a little fall cleaning instead of spring cleaning. The Indiana Death Registry, Know Me in the banner bar, some quick order tabs, and the diagnose, some information there. So we're going to jump right in. I wanted to highlight one of the changes that was sent out in the clinical IS updates, but I know no one really has time to read them all. So I wanted to kind of highlight some of the things, and one is actually around COVID-19 testing. Starting September 2nd, there's going to be a lot more options for testing choices as far as what type of patient qualifies for the testing. And so be prepared when you're choosing that as it comes up to try to really pay attention to what type your patient qualifies for. The reason that's important is that may speed up the test for that individual patient, because they are ranking them based on what kind of order was placed. And so that's just going to be important. One positive that has come out just this week with our COVID-19 testing locally that Dr. Pete Boss shared with us this morning is that our local outpatient testing opportunities are now up to 120 tests a day, and they're open 7 days a week. So that's huge compared to what we were able to offer. So hopefully it will be able to accommodate everyone. The biggest change, though, is in asymptomatic testing. We obviously have some patients that need asymptomatic testing because they fit these buckets here, where they're getting a surgical procedure done or pre-procedure, or possibly going to a nursing facility or a dialysis patient, and they do need tested when they're asymptomatic and meet those guidelines. But the CDC just made some changes this week that asymptomatic patients that even have been in close contact with a COVID patient, they're no longer recommending testing for those patients. There's a lot of differences in like workplace and schools and what they're kind of doing too. So recognize that not everyone will exactly be following those CDC guidelines, and they were just published. So that may be a change for a lot of folks when they're calling in, and we'll try to do our best to educate. But at this point, our hospitals primarily focused on symptomatic patients that would need outpatient testing, and then the asymptomatic folks that would need pre-procedural testing. Those would be, and then our OB admits before they get admitted, that would be, or as they're getting admitted, would be also tested. So let us know if you have questions, but wanted to point that out. Like I said, I wanted to share this good faith price estimate information with you. This was also in the clinical IS update. There was a new law that went into effect July 1 that requires hospitals to provide a price estimate for non-emergency services, and they have to do this within 5 business days. And so there's now a price estimates team within our hospital that is going to be doing this for patients. And I just wanted to make sure everyone had the address for that, because you may have patients ask about it, or you may, kind of want to tell a patient about that. There's also a phone number they can call. And I'm making I'll have these slides available and recording this so people can look back at it. The other big change is antibiotic indications required for IV and PO fluoroquinolones. Some of you may have already had this pop up when you're doing orders. So just be aware that when you're placing any orders for Cipro, Levo, or Moxie, you're going to need to make sure you're finding or meeting one of these criteria for that, and that'll be over here in the drop-down box. If you're not meeting those criteria, the recommendation is that you really need to reach out to ID and decide whether that's really an appropriate medicine for that patient. If there is still another indication, like there's a particular bug that's only sensitive to that drug, then that of course would qualify, but you would have to specify that in the comments. And so just make sure that you're doing a good job of being a good steward of those meds and honestly selecting what they would qualify for. So now we're going to jump into some of the Cerner stuff that's really, you know, I'm going to do some demos too, but I wanted to just highlight our message center box. I think sometimes this is what overwhelms us as physicians because messages keep coming at us and we're busy with the rest of our day and we're not able to deal with all of them right away. And just like email, it just kind of grows and you never get ahead of it. And so we really want to work on cleaning up and keeping our inbox cleaned up. I think it helps with anxiety on a daily basis if you look at a cleaner inbox versus having things that just keep going on for pages. And so one thing I'm going to show you on Cerner here in a little bit is how to auto delete messages when you are answering back to a nurse or a colleague and you're done with the message, you've answered them back. You really do not need to keep those in your message center. And so we want to make sure that you can select an auto default delete so that you're able to clean those up quickly. The fastest way, and I can demo this too, but I'll just say kind of how to do it. You're going to go and be in your inbox, like in the message center. And at the top of your screen, you're going to see inbox as one of the items along the very top. If you click on that and go through the list there, one of the options is manage preferences. If you then click on that, there's going to be a list of about 6 or 8 boxes that you could check. And one of them is default delete / complete checkbox when forwarding or replying. It's a mouthful to simply mean that when you're sending back a message to someone, you are done with that. And so you don't need to keep that in your message center. And for 99% of what we do with our messages, that should be good. And that way it keeps your inbox clean. Of course, there's going to be some messages that maybe you are still working on and you wanted to respond to the nurse and say, I'm still looking things up. That's completely fine. And you may want to then not do that. And you can uncheck the delete at the bottom that will be auto-checked once you set this. But otherwise, this is going to help you keep your box a lot cleaner. And I can show you here in a second how it looks on Cerner. But remember, our goal is that we should be dealing with our messages daily, you know, due to today's work today. And our goal is to complete those by the end of the day so that our patients get answered back. So definitely checking your messages sometime in the morning is helpful, and even sometime in the afternoon is helpful. I always say you want to check the messages when we have our nurses around, because our nurses really can be our helpers for communicating back to the patients. Otherwise, if we're not checking our messages until 4:30 or 5 o'clock, unfortunately, our nurses have gone for the day, and you may find that you have to, you know, sit down and make a few phone calls back to patients about some more urgent concerns. And that always adds to the end of your day. So help doing stuff when you have the help is really important. The other thing that I want to bring up is results. We really need to be calling those patients back or messaging our nurses to call those patients back within 48 hours, obviously sooner if critical alerts or critical results. So please make sure that you're also paying attention to dealing with those in a timely manner. And if you're ever running into situations and you don't know how to interpret results, obviously come to one of us directors, come to the staffing doctor. We're here to help and make sure that you understand what to do with the results, because I know sometimes it is a bit overwhelming when you're getting a bunch in. And just a friendly reminder about our clinic notes in particular, we want those completed within 24 hours of the clinic visit. Maximum would be 48 hours, so we want to keep working on that. We will be conducting random spot checks. We do that periodically, but just wanted to remind people that we're going to be peeking in, partly because we know that this is a skill that you want to develop now as a resident so that life as an attending is a much better life. So we want to make sure that you're developing those skills and staying on top of things. But I'll do some demo here in just a second. Jumping to a different topic real quick, just because this came up yesterday. One of the residents got notification that he had a death registry. Tobin there, sorry I didn't delete his name, but I think I told him I would be sharing. But he didn't recognize that when a patient that we're caring for passes away under our care, we will obviously be able or be responsible for the death registration paperwork that's online, and they will send an email, and I had Tobin send me the email, kind of body of the email, and this is what it will look like when it comes to you. It will come from the VR help desk, which is Vital Records. And so you'll get an email from Vital Records help desk, and they will then basically be expecting you to complete the death record. There's no link to go in necessarily and complete it, but there is this link down here. But you're going to go into the death record registry that you guys got registered for and complete it on the patient name. And so the funeral home has already added that patient name to your list of to-dos in there. And it is right now a very convoluted system, so they are moving to a much better, up-to-date kind of program, and that's that Drive system that you guys have seen emails on. I put the link here to get registered for a Drive training. I know Dr. Bunch and I just did it the other day. They said it was an hour and a half long, and I think it went really half an hour at most. So I would not be worried about the daunting hour and a half time that they said it would take. They gave a lot of time for questions, but all of us that use computers can do this. It's not hard. So it's just kind of getting familiar with what it looks like compared to what we're used to, or maybe not used to in the old system. So please, please, please register. Remember, when you're signing up, you're a medical certifier. That's what all of us physicians are. And so you need to register for that. The importance of this is that there is actually a state law that says the physician in attendance at time of death, or sometimes it ends up being the primary care physician if they do pass away at home, is responsible for filling out the death registry within 5 days of the paperwork being started. And so usually the funeral home is the person that actually starts the paperwork or starts the online form. And so you will get that email the day that they start that, and we have 5 days to complete it from there. And that's a super tight timeline for some of us, and I recognize that, we're not all great about checking our email. So this is why I wanted to point out what the email looks like and what to pay attention to. There is a part of the law that says we can be fined, and it really happens. So we definitely want to be getting our stuff in order and making sure. If you have any questions, Tobin and I talked through it yesterday. He did have to call and reset his password, and so that may have to happen, especially if you're not on a lot. I keep mine written down and just kind of a reference because we don't use it a ton. So, but just pay attention to that. Okay, so we're gonna jump into some demos in Cerner, but I wanted to first tell you about the demo. I know Dr. Witt at the recent Pulse Check brought up NOMI, which is the new kind of aspect of Cerner that allows us to put a lot more detail in the chart that then isn't part of the legal record. So it helps us maybe get to know the patient a little bit better, hence the name. And it is a space where anyone caring for that patient can make notes and everyone can see it. So just be kind of aware of that. I think most of us are cognizant not to put anything, deflammatory, anything in like that in the chart, but just be careful. Make sure you know what you're putting in there. The other important part, because it's a multi-contributor function, is that if you remove things, then that removes it from everyone's field and they may have needed that information there. So try not to remove stuff unless you feel like it was just truly an error. The nice thing about NOMI is that a lot of the information will populate if there's some social history documented, and that's awesome. The challenge is that you'll find a lot of our patients don't have social history documented in the chart. And so either that comes down to encouraging our MAs to help us with that. We can be part of that. And just the more we can update this, it stays live for the patient, and we can use this as a way to really kind of see what's going on. So I'm going to go into NOMI right now and share my screen. Hopefully everyone can see that. So this is a test patient, and the way to get into NOMI on any of our patients is to be in their banner bar, and you're going to click on their patient name. And I have, this was a patient I'm going to show you for some orders too. And so it's a fake patient who's 119 years old, but he loves being part of his grandchildren's lives. And so I stated he also enjoys fishing and make sure he can do everything to be healthy to go fishing. So, but I also said he's really not interested in cancer screenings at this time. And he's a hard stick for blood draw. So you can put anything in this field. This is kind of a nice little, they recommend it for like, what does the patient describe themselves as who they are and what their needs are. So you could have them just kind of tell you about themselves, and you can type that in. So that's what that field's for. And then the other fields here in the banner bar, our staff can now update a preferred name. And so a preferred name will come across on here too. You can't update directly from NOMI on getting kind of a preferred name, but if you need to update it, then we need to just relay that to our staff to do that. And then all of these fields down here, again, will populate if there's anything brought in from social history, which is great. But if there's not, there's also this nice free text box where you can just put some more details. And some of it's a little more pertinent than how the social history comes across. The other neat thing that I did the other day with a patient is their home address popped up, and so I just clicked on it, and it actually does a Google view of their house, and everything's kind of cool. And so you can see where they live, and maybe, the idea is maybe knowing what their resources are locally to them. And for some of our patients, that may be super helpful to point out where they could get certain things. And so understanding where they live in context of resources might be helpful. If in the chart they have an emergency contact, that will automatically be brought forward here, and advanced care directives as well. If you want more info on how to use NOMI, you actually can click this Get Started guide up here at the far corner, and it will walk you through each of the sections of NOMI, and that is kind of helpful. So if you wanted to know, like, what would I put there, that's kind of what that's for. So it's nice to get an idea of what NOMI is all about. But like I said, it can be a really good field for getting to know our patients a little bit better. And then while we're at it, I just wanted to show you, I'm going to go into my message center. And when you're in message center, if you click inbox, that's where I was talking about managing your preferences. When you click manage preferences, I already have it clicked because that's what I definitely want to make sure I'm deleting anything that I'm done with. And so you can click that default delete, and then you just click OK at the bottom, and it's saved. And so now anytime I respond back to a message, it will auto delete that from my message. And so I don't end up with any messages hanging around. So make it a point to keep your inbox clean. And if you are struggling with that, we completely understand that's a skill that takes some time to learn. Please come to one of us. Your advisor will be reaching out, like I said, if we're having some spot checks, just to help you develop those skills to keep up on top of things. So. And then let me click to remind myself what our next slide is here. So now we're going to talk about quick orders. And some people have used a lot of quick orders, both the outpatient, mostly the outpatient, but I know that there are inpatient quick orders, and they have just added power plans to those. So I wanted to showcase some quick orders and what to do with that. Let me go back to our Cerner. We're going to go back in this guy's chart. And so when I'm actually in a hospitalist view right now. I did find the quick orders for inpatient to not be an option when we're just in our family medicine view. But for those of you that are on AIMS for the block, I think this would be a great time to just change your experience over to inpatient, hospitalist basically, and that way your tabs are simple at the top. You have your inpatient hospitalist workflow, your discharge workflow, and your quick orders for hospitalists. And when you click on quick orders for hospitalists, yours may not look like this because I spent a little time yesterday organizing mine, but I wanted to show you both how to organize, but also what in the world is going on here, because honestly, there are some great things that I didn't know were hanging out here that will make life faster. So when we're doing admissions, they've now added a lot of the power plans that we would need, kind of right off the bat. It's not all the power plans, of course, but our general admission order set is there, DKA is there, and then obviously when we click into the general admission order set, all the other ones like pneumonia, COPD, chest pain are always still going to be at the bottom, but this is just a fast way to grab them. The other nice thing about on here is there's a lot of the typical meds that we may be ordering for patients right off the bat, the infusions that we may order right off the bat, some respiratory stuff, and some labs. I really like what they've done here where you can actually, if you are ordering the labs under the 6 a.m. labs, then they auto do that for you. So you're not having to think about what time I'm ordering, because a lot of times on admissions, there are a mistake made because we're putting in the labs at a different time. And so I think that can be helpful for you guys. Rehab orders are here, diagnostics are here, like your telemetry, blood bank, and then even patient care orders are down here. And so if it's not a place that you have frequented before or much at all, it may be someplace you want to start frequenting. And the way to get it, especially if you've got a large screen like most of us have access to in the hospital now, putting the 5 columns is awesome. It really makes it easy to see. And to do that, you're going to use the little hamburger sign over here, and you can click drag and drop, and you can click collapse all. And when you do that, then you can just quickly see the headings, and that way you can move things around wherever you want them. So, everyone can have their own methodology to how they want to see stuff. I like to see problems and diagnoses over here. That's just more from the outpatient world that we're really needing those, but I like to keep them in the same place everywhere I go. And then I've kind of spaced out everything else based on what I would want to see kind of from right to left. So, or left to right, I mean. So I guess that's the biggest thing I want to showcase as far as inpatient labs or inpatient quick orders. I'm going to switch back here to family medicine view and show you what it looks like. Let me get out of this guy's chart and then back in. That's usually the best way to go about this. So now we are outpatient view. On the outpatient view for family medicine, we still have an inpatient hospitalist tab, but what you will notice, even if I went to try to expand, there are no quick orders for inpatient on our family medicine tab. I definitely will talk to them and see if we can get that, because we've got the inpatient hospitalist and inpatient hospitalist discharge. So that very well might be something we can add, but we just don't have it yet. So, but we do have the quick orders for family medicine in the outpatient world. And those, again, are super helpful because you can see all your problems and diagnoses. You can add stuff to the visit for that day. If it's a chronic problem, so this guy has carotid stenosis, it looks like it was already added. But if he had another chronic problem, I could just click that double arrow and put it up into today's visit. And so anything listed here in this visit is fair game for me to order something under. So if I really wanted to order an A1C and a lipase, I'm ordering some really random things. I'm going to order an echo for him today. And we're not on an outpatient encounter, sorry. I don't think he has an outpatient encounter. So that's my one hang up there. But if we wanted to order any other thing, we can do that all pretty easily. And then when you've put quick orders in on either space, whether you're inpatient or outpatient, the way to sign them is to go to the little file box up here, and it usually has a number corresponding to all the orders you've put in. When you click the order in the file box, what it's asking for you to do is associate a diagnosis with the order. In the outpatient world, this is required, and I think most of us have become familiar with this requirement. If you haven't, then you're maybe not putting in a ton of orders, but hopefully you've had some practice with this. You may not have seen it in this manner though, because you may be you're not using the quick orders tab. And so for his A1C, we can say that's because he's had an NSTEMI, etc. And then when you go to sign, it will bring that up and then sign the orders based on that. And so it's the same thing when you're doing the inpatient quick orders. The one challenge is that you will obviously need to modify, like if you're doing a power plan, there's a lot to add to that. And you don't have to associate a diagnosis with an inpatient order. You can, and it's definitely okay to do so, but you're not required to do so as of yet, I guess. Coming very soon, we will be dropping our charges in the quick orders tab and not using a super bill. That is coming in October. So be prepared. So those of us that haven't been hopping on quick orders are going to be hopping on quick orders. All of us will actually. And so from the outpatient perspective, we're going to start this likely around, they say October 6th is the go live. I'll be involved in meetings before then to get more information and make sure we know what we're doing. And then from the inpatient side of things, they are predicting spring or summer next year will be inpatient orders or inpatient charges dropped via the quick orders tab. So it is a place that you're going to want to get familiar with. Again, you can do your own moving around and drag and drop and expand and put things in the order you want to see them. There's a lot of things on here. There's in-office procedures, in-office medications, and we'll be talking more about what things we as physicians are going to need to actually order for the charges to go through. Because right now I know we're not putting a lot of the orders in for point of care, but we probably will be doing some of that when that all changes. Okay, let me click. I'm going to go back. So now I'm going to switch gears, and at the end, hopefully, it looks like I'll have enough time for questions, and we can go back to Cerner. I can show you that screen, answer questions, but I want to get through the last little bit of this, which is really on diag notes. So I'm going to stop sharing my one screen. I'm going to share my phone. So hold tight. Okay, has everyone seen my phone, hopefully? Yes?
Yes.
Can you see my phone? Okay, perfect, thank you. So we are gonna talk about diag notes, and I just wanted to bring about a few concerns / questions that have come up. I am also trying to get a little more involved with the diag notes committee with the system. So yes, you can pay me back in wine or something, but Mondays, 10 a.m., anyone wants to join. So I wanted to show you guys a couple things on diag notes. One is on backup notifications. I know there's been a lot of situations where people have said, I haven't got my page, I didn't hear it, etc. I was on Do Not Disturb and I accidentally didn't turn that back off. And so one of the areas you want to go to is actually under your settings, and there's now a tab called backup notifications. When you go to that, you want to enable. Normally it actually looks like this. You're going to click on enable backup notifications, and you can change the time when that backup notification happens. So if you're a little worried that you're not going to get them very quickly or you're going to miss something, you can change that time to a little earlier. And then you go and you can change your sound. We can make it the boom boom sound. And then we can, the best way to make this happen is then you actually click into your settings for your phone. It kind of directly lets you click into that, and you go to notifications and allow critical alerts. So that means at any point, even if you're on do not disturb, your phone will push through this backup notification so you won't miss your pages. So if you're someone who's a little bit prone to missing pages, etc., this may be a wonderful thing when you're on night float or call or whatever. And so I just wanted everyone to see that. The other option in that, let me go back to Diagnotes here, is there are backup emails that can be sent, backup pager notification if anyone's still carrying a pager, and a backup text notification. So any of those can be your backup way to make sure you're not missing things. So I just wanted to make sure everyone was clear on that. We do know that right now, I sent an email, a couple weeks ago. Lauren and I shared some back and forth emails about being marked unavailable, but still getting a notification through Diagnotes. The challenge is right now, you can go into your profile. And I don't know if anyone, I think most of us know how to do this now. You go into your profile and you can mark yourself unavailable. When I mark myself unavailable, all it means is I'm unavailable to any new communication messages in Diagnotes. So a nurse from the floor, if she was trying to get a hold of you, she would pull your name up and you wouldn't be available, so she couldn't send you something. If I hadn't been in contact with you before and I was trying to send you something, it would also give me an alert or a red box that you weren't available. However, if you and I had had a message going before and neither of us had completed that message, I could actually technically send you a message even if you are marked unavailable. That is a known, like I say, glitch right now in Diagnotes. That was just brought up at our meeting this past Monday. They're trying to figure out a workaround or a fix to that, but the challenge right now is there's not one. And so the best fix is that we actually want to try to, again, my theme today is clean up your inbox. So we're cleaning up our Diagnotes, even though some of that might be very daunting to some of us, myself included. So if you go to messages, here's my current messages. Actually, I'm on my active. Let me go back. Active search. Okay. So here's my active messages. And if I am cleaning up my messages, I can click on one. And if I want to complete this, I'm going to click the check mark at the top. So when I complete that, that means that my conversation with Alex is now done. And so the challenge is it also comes off Alex's list, which is great. I just helped her clean up her inbox, but it is possibly going to be frustrating to the other individual who may want to keep that message. And we'll show you how to look at those old messages in a second. If you would rather just be done with that message, but you don't want to mess it up on the other person's end, you want to leave the message. You actually want to just leave it. You don't want to complete it. So the best way to do that is to go to that message, and now instead of the check mark, you're going to click the I, the circled I, and you're going to click under options. When you click under options, you can click leave the message. It's again going to verify you want to leave the message. And now I've left the message, but actually it's still going to be on Lauren's message board. So she could still get in the message, but I've left it. When I've left the message, I can't get any messages back if I'm marked unavailable. So those are the two ways to kind of make sure no one can get a hold of you. I know that sounds funny, but sometimes when we're off and away, we want to make sure we're not, people aren't going to keep paging. IU Health Paging can't get a hold of you if you're marked unavailable. But someone who, like I said, had a previous message running with you. So those are two ways to kind of clean up your messages. There is no way right now to do like a mass cleanup. I wish there was. I asked about that, and I'm hoping there might be. My goal would be to swipe right and you complete, swipe left and you leave. I'm hoping that maybe my idea will stick with them. The other thing is I want to show you guys, if by chance you complete a message or maybe someone else completes the message, to see those messages later, because I know the traffic person will complete the messages a lot, and some of the residents are getting frustrated that the patient information they need is gone. It's really not gone. You go to your messages tab. Now you click where it says active. If you click on that, it'll pop up and you can click completed. And when you click completed, you can actually search. So if I wanted to search, well, Alex, I can search any, I don't know what there. So it'll bring up anytime that she was in the conversation that I had completed. So if you can say, man, I know I had a message running and I sent Kristen a message and I can't remember what I said or what she replied, and this was a week ago on a patient, and you've completed it, don't freak out. It's not gone. It's just in the completed box. So that's how you get there, is just by toggling between active or completed, and you don't have to search necessarily when you click over. But hopefully that helps you guys understand a little bit more about how DiagNotes can work for you. And like I said, I am involved, and Amy Airy may become involved in the DiagNotes committee that meets every other week on a Monday. So if you have DiagNotes concerns, especially, or ideas about improving it, let me know, let Amy know. We'll try to share those. They seemed very receptive, and they're trying to make the system work for us. So sharing is a good thing. And I'm gonna stop sharing my screen now. So one more stop. And now we're back into this, and I need to share my screen one more time. And this is our final slide for a little app. And I know I saw some chat questions here maybe. And so Lauren has a question here. Has anyone tried auto forwarding messages? Does this work? And should we auto forward messages to whoever's covering us? Good question, Lauren. They actually talked about auto forwarding this week on the call. The challenge is there seems to be possibly some concerns that auto forwarding will still have some issues if you have a running message with someone. So it doesn't seem that if you auto forwarded on DiagNotes, so if Kristen's covering you and you auto forwarded your messages, new messages would go to her. Anything that was already pre-established would not. And so that's still not going to fix our concern of, people being able to get a hold of you if you were if you were marked unavailable. There was one other physician on the call, and they had shared that they felt like the auto forwarding was not 100% reliable. And I haven't used it much myself, so I couldn't vouch for that here or there, but there was some concern. So I guess if you did auto forward, I would relay to the person you're auto forwarding to and just say, hey, I'm going to try this out and see if this works this weekend or whenever they're covering you. And then let me know if you're noticing any problems. But it won't work if you still have a running message with someone. So that's where cleaning up your message center or your box can help. So, oh, and happy hour, yes, the drinks. I'm so sorry. We really need the wine bar. I'm still working on that. So, other questions, chat, anything?
I had a question about the Cerner date period, mostly for results review. I know last year we went over that, but I found that really helpful to have a default. And I remember doing it for, like during the noon conference, but it only changed one of my results tabs, not every single one. So there's one tab where we'll go back like a couple of years. The other one is just day by day.
Right.
So I If you could go over that.
Yeah. So if you, you can change criteria here. If you right click in your time span here, oops, where'd it go? Hold on. All of a sudden my Cerner went away. Come back, Cerner. Let me end the slideshow so that I can get out of that. And then I can just show Cerner. Okay. So you can change your clinical range there, and usually you can change it to, let's see, posting range, result count. It's not, you don't really want the result count. That's not the right spot to change it. Hold on. That changes it. You can change it for a given year. Let me go up to the actual time scale options. This is where I always have to look, sorry. Change search criteria. Nope, that's not it still. I think it's under properties. Yeah, so it's under properties, so options, and then properties. In the default range offsets, you can set your forward and back to whatever you want, and I set mine to 2 years. And so that's where you can set it, and then your adjustment increments can also be set like 2 years or 5 years or whatever. Once you save that and then click OK, it should save it for everything, but let me try it out here because I know I've done it for lab results. Let's look at pathology. Some of them have a default. Let me see if I'm going to go into this here. Properties and defaults. So some of them, Kristen, I remember learning this somewhere along the way, that they auto defaulted certain categories, like pathology doesn't have a ton in it. And so they auto defaulted those to 10 years. So they did that for us to help us a little bit. The labs are the one that they auto defaulted to a lot less time. I think 6 months, and maybe even less. Someone who hasn't done it can tell us. I don't remember the auto default. And so that's the one that you really want to change is your lab results. Radiology may also be the same. So you have to go into each category and change them because they kind of helped us a little bit, but because of that, it makes it a little confusing. So.
Okay, thank you. That's helpful. I had another question then.
Yeah.
Is there still a search feature within each chart to say, hey, I wondered if this patient got a colonoscopy review? I know that's probably a bad example, but just how to search within the chart.
Yeah, I don't believe there is. If someone knows that there is, it used to be actually under, like you could go to clinical notes and they had a search feature, and I'm looking right now to see. It doesn't look like there is.
Yeah, I thought there was at one point, but then I lost it somewhere. So
yeah, I will ask about that.
Kristen, though. I noticed the same thing. There was a chart search function on the bottom left, like dark gray list. I used it all of the time, and it's definitely gone.
I will definitely follow up on that and ask.
Okay, thank you.
Anything else on Cerner? It doesn't have to be even on the topics we talked about. If you guys have ideas or things that you're like, man, I wish Cerner would do this for me or do that for me, or if they're just, daily frustrations, please bring them up. I'm happy to see if there are workarounds to what your daily frustration is, and maybe there's actually a fix that you just didn't know, or maybe it's just like that, the chart search is gone and we want it back. So I just need to know those things so I can share. I don't want anyone pulling hair out daily for Cerner. I know that we all have our other challenges, COVID, etc. So let's not lose hair over Cerner. So anything else?
I had a question kind of back to the death registry and filling out causes of death.
Yeah.
I know sometimes it's pretty clear cut, but I know I've heard in the past there's certain rules, like you can't put heart failure or liver failure as a cause of death. It has to be something more specific. So I didn't know if there were any specific rules for that and if you could maybe explain them a little bit.
Yeah, good question, Rachel. There are specific rules. I do not have those memorized, but I did find a really nice FAQ, and so I'm going to send that out to you guys. Because there are some like little nuances of, and honestly, I'm not going to lie, I will sometimes have to reference things like, can I put that down or not? I do know they need specifics as far as like, did they die because of cancer or did they die because they had respiratory failure, because then they had lung cancer. So they would prefer respiratory failure as the cause of death, and then secondarily to lung cancer. So I do know that they want more specifics on like lung cancer just didn't kill them. They actually, what happened because of the lung cancer. So I do know that, but let me get this document. It was actually put together as like a physician quick reference, and it looked fairly good. So I'll send that out to you guys. And then maybe we can even post it over here in the lounge. So if you're filling one out and you need to look at that, it'll be up on the board above your computers. So
That would be helpful. Thank you.
mm-hmm.
I had another question. I'm full of questions today, Dr. Schreiner.
Awesome. Love it.
For Cerner's advanced directives, I know kind of in the top banner, there's a patient that, and I have down that there's an advanced directive. So I click on that, but it really doesn't help me out at all. I can't find where the post form is or where it would be, aside from going to, you know, the results review tab and trying to sort through all of the clinical assessments, or
Right.
I know if there's a tip or some kind of
Yeah, and Lauren may
trick.
be even better to help me because she's involved in a little bit more palliative care stuff. But I know I usually have to go to, this person doesn't have one, so that's going to be the challenge. But either through clinical notes, because they usually have a, I don't know what category. I don't know if they've now labeled it as advanced directives, but I feel like they've made some changes to these. And so I go in through either clinical notes, try to look at type, and then if not, down here under forms, I will also go in that way and look for it that way. But I don't know if someone that's doing it a little more often than I am may want to comment on that.
I will say I honestly haven't taken a close look at it recently since they added the banner change up in the top. So I don't know if it used to be in the clinic notes. There was a folder that said directives on it and people scanned in forms. But
we'll look and I'll share that back out with everyone so that we all know, because I agree. I think the biggest thing we need to know is HIPAA a lot of times with patients, and advanced directives, like who can I call and talk to, and then what are their wishes, and like verifying those wishes, especially when they get admitted, is really helpful. So that's a great little like kind of update for all of us. So I'll make sure I figure all that out and send that little update.
Okay, thank you. I appreciate it.
In the vein of calling people's families and trying to figure out if you can leave messages, I don't know if everybody is aware of this. Someone taught me this my intern year. You can view, like, if it's a clinic patient, you can view their specific form they filled out that gives their phone number and whether or not they gave permission to leave messages on their voicemail. Does everybody know how to get access to that? Because I use it like on a regular basis.
I don't, Lauren. Let's share.
If you go up to view, it's either view or patient. I usually have to click around a little bit.
Like on the left?
The top of the screen.
Oh, up here.
Yeah, I think it's view. Maybe it's patient. Sorry. And then view images. Usually you can see a scanned in HIPAA form. I don't know if it will be.
It won't be on this
present on this particular person, but it'll be like one of these documents that you're hovering over.
Nice.
And it'll be titled HIPAA form.
Okay. I love it.
That's usually pretty helpful if you want to know if you can leave a message.
Perfect. So patient view images. Okay.
I also struggle with knowing if the voicemail is generic. You know, and it just tells me their number, can I still leave a message even if they've said it's okay to leave a message if I have no verification that this is still the correct number?
Yeah.
Any insight on that?
I'm usually pretty conservative and I won't leave any details. So, you know, depending on what the situation is, if it's just, you know, I mean, you want to be cautious because even saying that you're a doctor's office can be, you know, HIPAA violation. So it just depends on what you're trying to get a hold of them for. I think sometimes I will leave that just as this is Dr. Schreiner's office, you know, calling for Susie Q, if she can call back, that's pretty generic. But, you know, if there's any concern about even that, I probably won't leave a message, unfortunately.
Okay, that's helpful. Thanks.
Anything else? Thank you
I
guys for
wanted-
attending. Yeah, go ahead.
Sorry, one more thing. For the diagnotes, one thing that I found super helpful was to have like the timed out do not disturb function.
Mhm.
I don't know if you use that. And that's, I assume, similar to the do not disturb function that you showed us, Dr. Schreiner.
Yeah, the do not disturb though on diagnotes means that you just won't hear those come through, but they can actually still text you. So be careful. So that unavailable means that, like, if you and I didn't have a conversation going already, it shows me as a little, so it shows you as like a little red box or triangle, and I can't actually get you. But you marking yourself do not disturb is really just kind of like we turn our phones off do not disturb so they don't wake us up. That's really all that does for diagnotes. And so you may get back onto diagnotes 8 hours later after you slept or whatever and realize that 4 people sent you messages. So unfortunately, that's the challenge with the do not disturb. It sounds like it should be like no one should get a hold of you, but it actually doesn't show the other person that you're not available. So
Okay, that's helpful.
it still allows messages to go through. It just, you won't hear them. So.
Okay, thank you.
Well, thank you guys for attending and paying attention. And if you have things, please send them my way. You know, I know sometimes it's hard to summarize it. If you just want to stop by my office and tell me the concern, happy to look at it with you and then try to make life a little easier. But like I said, with diagnotes, let me know if there are things. I'm going to keep pushing for some changes because it's definitely not working ideally for us yet. So, well, thank you guys. Have a great afternoon.
Thank you, Dr. Schreiner.
Thank you.
Mel.
Yeah.
Hey, Wilson here.
Yeah.
I might have missed it. On your, like, the hospital is those quick orders. How do I
Yes.
get that on mine? Like, how do I get that view?
So you're going to go to My Experience, and you and I, we as attendings, we don't have to do this super often, but up
Okay.
at the top of your screen where I'm at right now, can you see my Cerner?
Uh-huh.
So I go, oh, it wants to keep giving me the chat function. Come here. Okay. Click on My Experience, and then
Okay.
you're going to scroll to Hospitalist View,
Okay.
and then you're going to save it.
Okay.
And once you save it, then what I do is I actually get back out of the chart because it won't like auto switch while you're in the chart.
Mhm.
And so then I just click back into that same guy's chart that I was wanting to see the hospitalist view. And now I'm the hospitalist view.
Okay. Okay.
And so, and then like I said, we have access to those two. So that's on my list of to-dos, is to ask if we can just have this quick orders, because then if you're rounding, you could kind of just change what you wanted to see up here in our
Right.
family med view. So I'm going to ask for it, but I don't know if we'll get it.
Okay. Hey, thanks so much.
Yep, no problem. Thank you guys.